Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, the World Health Organization declaring the level of coronavirus disease threat to very high.
We have now increased our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global level.
As more countries confirm new cases of the infection daily.
Is the volume more than 100,000? Because if it is more than 100,000, that's going to be presenting high risk. Ay yung iba, kung di nag-travel ban sa China. So pasukan din yung mga travelers and persons from China may risk sa atin yun.
South Korea working double time to contain the virus.
Meron kaming suporta galing sa Korean government na mga mask. Binigyan kami. At the same time, yung everyday na pagpapaalala ko, ang hinihingi lamang po ng mga Pilipino dito ay masuplayan yung kanilang pangangailangan like mask, alcohol, sanitizer.
But is the Philippines ready if a massive coronavirus outbreak does hit?
There will be a risk assessment and there will be other impact assessments that will be done.
Former Health Secretary Manuel Dayrit and former Filipino community leader in Daegu, South Korea, Alicia Lipato, join us live. Thank you for joining us. I'm Pinky Webb. More countries are reporting their first case of the coronavirus disease or COVID-19. The Czech Republic confirms its first case of the novel coronavirus. The country's health minister says the 3 cases diagnosed included an American student studying in Milan, Italy, who had traveled to Prague as a tourist. In all 3 cases, patients had visited northern Italy. Meanwhile, the Dominican Republic also confirms its first case of COVID-19, a 62-year-old Italian man. According to health officials, the man is stable and in an isolation room. The number of coronavirus cases in Italy has climbed to 1,694, according to the country's Civil Protection Authority. The country reported 34 deaths so far. In South Korea, the country's Centers for Disease Control and Prevention announces 586 new cases, bringing the country's total to 3,736. Authorities also reported 1 fatality, 1 new one, following the 17 people who had previously died. South Korea has the largest outbreak of the virus outside of mainland China. And there are now more than 87,000 cases worldwide with more than 2,900 deaths. Meantime, Chinese health authorities have already recorded more than 40,000 patients who have recovered from the disease. Meanwhile, in the United States, a person in Washington has died from coronavirus, marking the first confirmed coronavirus death in the United States. The White House has announced new travel restrictions because of the virus. 2 more coronavirus cases of unknown origin have been reported in the U.S. states of Oregon and Ohio. This leads to the question, is this proof of a community spread of the virus in the United States? CNN's Andy Rose has the details.
We have a case who did not recently travel or come in contact with anyone known to be ill.
A new case of unknown origin, a possible case of community spread in Santa Clara County, California.
The virus is here, present at some level, but we still don't know to what degree.
This as the U.S. stock market suffered its worst week since the financial crisis in 2008. The Dow dropping almost 1,200 points Thursday, the worst one-day point drop in history.
I hope the Fed gets involved, and I hope they get involved soon.
Coronavirus fears are now having a rippling effect on the entertainment industry.
To walk off of a building for $1 million.
One of TV's biggest shows, CBS's The Amazing Race, is suspending production. And now iconic pop-punk band Green Day and South Korean boy band BTS are joining the ranks of artists canceling concerts in Asia. Green Day tweeted an apology to their fans, saying, quote, We know it sucks, as we were looking forward to seeing you all. But hold on to your tickets. We'll be announcing the new dates very soon. Google and Amazon have joined the ranks of Facebook, canceling major conferences due to the coronavirus situation. Microsoft founder Bill Gates even weighed in, calling the epidemic an immediate crisis and questioning if this will turn into a once-in-a-century pandemic. I'm Andy Rose reporting.
Let's go straight to the source of the story. We have former Health Secretary and SARS czar, Manuel Dayrit. Dr. Dayrit, good to see you.
Good morning, thank you.
Welcome to the show. So you have the first coronavirus death in Washington State, in the United States due to COVID-19. The thing here is, Dr. Dayrit, there's been no travel history of this man to an infected area of the coronavirus and no known exposure to a person also with symptoms of the COVID-19. What could be happening?
Well, what could be happening is that they already have mild cases occurring. They haven't been able to detect it. In the US, the number of tests that they've been able to do is very low. They're only about 500. So it could actually be spreading, and this person could have been infected by one of those infected cases.
But that means somebody there in Washington State must have been infected for this man to have died due to the COVID-19, because he didn't travel to a known affected
Yes.
area. He wasn't supposedly exposed to somebody who had symptoms or COVID-19. So it makes you believe, is that what you're saying, that somebody there is actually infected
Yes.
with COVID-19?
Yes.
It definitely looks like that's the direction it's headed to, because there is a facility also in the same state, a nursing facility, that have two symptoms of the COVID-19. And now the authorities there in the United States, in that particular state, are saying that they're looking at a possible outbreak. How do you explain a situation like that, Dr. Dayrit? There's a nursing facility, and there are homes, just at its perimeter, very near the nursing facility. Is that a big cause for concern?
Yes, one way of explaining it is this. The cases actually originated from China. Some of those cases may have actually entered the US, but entered under the radar. Now, call that the index case, the imported case from China. Now, because that person came in, probably had a mild illness or maybe even none at all, and then infected somebody else, that's first generation. And therefore, that first generation, if this person was infected by somebody in the first generation or even in the second generation, then you wouldn't be able to detect a history of travel to China or even contact with somebody who traveled to China.
Really?
Yes.
But if it's a second generation of an infection, you can find out from that person, for example, who died, who did he come in contact with? So that brings you to the second generation, and the second generation can bring you to the first generation, although that would be tedious.
Yes. And you'd have to have a very, very good history to be able to do that.
That's true. Okay, looking at the numbers, as we mentioned a while ago, first death in the United States. Also, sir, in Thailand and Australia, the first reported deaths. I believe in Thailand, one was, I think, dengue and COVID-19, and then Australia was, I think, a person who had arrived from that cruise ship. Look at the deaths. If we look at the deaths right now, China still on top with 2,761, Iran 54, Italy 34. All of a sudden, you wake up one day and there's this rise of deaths and infections in countries that possibly had zero infections, Dr. Dayrit.
Yes, that's what's worrying about COVID-19. In fact, the case fatality rate is quite high. They're computing it at around 2%, but it could actually be higher. And they're saying there are a lot of mild infections that they haven't detected, and therefore they're saying it's lower.
Yeah.
But if we compared it, for example, with H1N1, influenza, the case fatality rate for influenza was 0.01, much, much lower than COVID-19. Well, in comparison to MERS-CoV, MERS-CoV had a case fatality rate of 35.
Right.
And SARS had a case fatality rate of 10%. But the difference with COVID-19 is that it's explosive. It's very explosive. In fact, it has a reproductive rate of 3 on
What do
the
you
average.
mean by a reproductive rate
What
of
that
3?
means
You
is
infect
that-
3 people?
Yes. One case infects 3
I see.
in the first generation. These 3 cases can infect another 3 each, 9, and so on and so forth.
Right.
And therefore,
Multiplier effect.
Exactly. So what's probably happening in Europe now is that the cases that have spread out have actually multiplied themselves already exponentially. But because the testing for COVID-19 is not very, very systematic, the available test kits, they're not commonly available. Therefore, because they're not testing it, many of the cases are flying under the radar.
I see.
That's
because we
the
don't
case.
know for sure because there's not enough tests
Exactly.
to find out if
Right,
you're positive or not. So as I was saying, you have 56 countries now infected. If you said 2% of mortality rate, we may have to re-edit that. Because if there are 85,000 infections now and close to 3,000 deaths, I would assume that's about 4%.
That's a little bit higher.
Yeah,
Yes.
4%. I say this, Dr. Dayrit, because when this began, it started December 31. And then we're on our second month right now. On the first month, it was almost downplayed in a way because they were saying the mortality rate is so low. It's at 2%. But now, 2 months later, or 1 month after the 2% mortality rate, you're now at 4%. So is it time to double up on the precaution of all countries and especially its spread in every country in the world?
You know, the precautions are there. In fact, airlines themselves are already initiating cancellation of flights. The travel ban is there. In fact, the precautions are already there. The thing is, it's community spread already. Now, WHO, interestingly, is not calling it a pandemic yet. And you know the reason for that, I think, and this is personal, is that with H1N1, they declared a pandemic, and critics came back at them and said, you're exaggerating the problem. The situation now is reversed. The public perception and the fear for COVID-19 is far, far greater than the fear of H1N1. And that's the reason people are saying, why aren't you declaring a pandemic yet?
Are you okay with the WHO calling this the highest level of alert and still not a pandemic? Or is it time to call it a pandemic?
You know, they're hedging. And of course, the WHO experts will say, whether you call it a pandemic or not, the control measures are the same. Okay, but I think that's what they're trying to prevent.
Right.
Okay, any criticisms that they've exaggerated the problem.
But you know, when you use the word highest level of alert compared to a pandemic, I don't know, it would be subjective. Some people might say it's one and the same. But others, there might be more fear or threat if it's actually called a pandemic by the WHO.
Yes, and when they call it a pandemic, it's like declaring a disaster. Okay, a lot of legal issues come in, a lot of issues about flow of resources to countries come in, and I think they're not ready to deal with those issues yet.
What will it take to call it a pandemic?
I think if they can say that there's really community spread in a very, very large number of countries across all of the continents. And I think they say we're still not there, but it looks like it's spreading the way towards that level.
We'll be taking a short break coming up. We're going to check the situation of Filipinos in coronavirus hit Daegu City in South Korea. Also, what does it mean, again, when the World Health Organization raises the coronavirus threat to the highest level? Former DOH Secretary Manuel Dayrit will still be with us after the break. You're watching The Source on CNN Philippines. South Korea has the most number of cases of coronavirus disease outside China. As of Monday morning, 17 people have died and more than 3,500 infected. More than half of the cases are from the city of Daegu, where the outbreak started. The city now looks deserted. Most businesses have closed shop since cases of COVID-19 began to spread. So far, no Filipinos have been infected in South Korea. Let's go straight to the source of the story. Joining us via video call from Daegu City, South Korea, we have Alicia Lipato. Alicia, thank you so much for taking our call.
Yes po, good morning Ma'am Pinky. Maraming salamat din po sa pag-interview ngayong araw na ito.
Alicia, 19 years ka nang nandyan sa Daegu. Kamusta ang sitwasyon ngayon matapos nga itong mga infections dyan sa Daegu?
Opo ma'am, medyo talagang napakahirap yung aming sitwasyon ngayon dito. Kasi first time kong nangyari ito dito sa Daegu City na nakatira ako for almost 19 years. So parang ang laki ng pag-a-adjust po namin talaga.
Kamusta yung, ano nakikita, hindi na lumalabas sa mga tao sa labas? Ganun ba talagang, nagpapakita kasi kami ng video, parang it really seems as if it's deserted. Wala bang taong mga lumalabas ngayon? O,
Yes.
you know, go ahead, Alicia.
Meron naman po ma'am, pero mangilan-ilan lang talaga yung mga naglalakad sa kalsada. Makikita niyo na lang yung mga minsan lalaki or hindi masyadong matanda na or bata kasi delikado sa kanila yung lumabas ng bahay.
Opo. But, kayo, lumalabas pa ba kayo?
Kahapon ma'am lumabas kami kasi maganda yung panahon, medyo maaraw, so lumabas kami ng mga 2 hours lang sandali ng mga anak ko. Kasi nakaka-boring talaga sa loob ng bahay, kailangan namin mag-exercise.
The thing is, you're a part-time English teacher, and you told us, no, Alicia, that it's been 2 weeks of no school and resumption is going to be on March 9. Is that correct?
Opo, tama po yun.
So, paano pinaghahandaan ito ngayon?
Sa ngayon po, nakikinig kami ng mga balita at sinusunod namin yung mga exercising sa good hygiene, procedures, yung mga ganun po. At saka yung Korean government naman, lagi naman silang nakikipag-cooperate sa lahat ng mga Korean dito.
What about supplies, Alicia? Nagkakaubusan ba dyan ng mga supplies, ng mask, alcohol, tubig, pagkain?
About po sa food at saka sa water, wala namang problema doon sa mga pagkain. Ang talaga lang po ang problema namin dito is yung mask at yung mga alcohol. Kasi kahit yung mga Korean, pumipila pa sila para bumili lang ng mask. Tapos sa isang tao, 2 or 3 mask lang ang pwedeng makakuha nun. So kami kung mga Pilipino is wala talaga kaming makuhanan ng mabilisan dito.
So, dati ka kasing chairperson ng Daegu Filipino community. And I'm sure, ibig sabihin yan, ang dami mong kilalang mga Pilipino dyan. Anong pinakamalaking pangamba nila dyan na sinasabi sa inyo?
Yun nga ma'am, yung marami nagme-message sa akin kasi yung iba na, especially yung may mga anak, nag-stop sila ng work kasi yung mga anak nila hindi na po pwedeng ipasok sa mga kindergarten dahil nga close na rin dito yung mga kindergarten at saka school. So wala silang magagawa kundi magstay ng bahay kasama yung mga anak. At number 1 na pag-aalala nila is yun nga po yung mga hygiene, yung mga mask na kailangan nila. Kahit sa loob kasi ng bahay, nagmamask yung mga nanay para lang sa anak. So kailangan talaga yung mga ganon. Sobrang hirap po ng dinadanas namin din ngayon dito.
Meron ba kayong panawagan, Alicia, sa mga officials natin?
Opo, actually, ang Philippine Embassy naman po dito sa South Korea, nakikipag-connect po sa akin na nangungumusta kung ano na yung kalagayan ng mga Pilipino dito sa Daegu City. Pero hanggang ngayon ma'am kasi, yung inaantay nilang mga mask, wala pa talagang dumarating, may isa. So ang Catholic Worker Center po dito, si Father Fall, kahapon namigay po siya ng mga mask sa mga Pilipino dito sa Daegu City. Hindi rin naman sapat kasi hindi lang Pilipino ang tinutulungan ng Catholic Worker Center, marami pa pong mga ibang lahi. So hindi talaga sumasapat yung mga pinamimigay dito sa aming mask ngayon.
Okay, yun ang pinakakailangan nila ngayon dyan. At least to the authorities, no? Sa nakikinig sa atin, kailangan ng masks ng mga kababayan natin dyan sa Daegu City. Ilan ang mga Pilipino dyan, Alicia? Sa Daegu
Sa
City?
ngayon po, sobrang dami na ho. Hindi ko na yung mga workers lang at saka yung mga Korean wives dito, siguro mahigit na mga 6,000 to 7,000, mga ganon.
And wala ka pang nababalitaan na Pilipino na may sintomas ng COVID-19?
Ay, wala pa naman po at sana pagdasal natin talaga na wala talaga.
Okay. You know, Alicia, katabi ko si dating Health Secretary Dayrit, Dr. Dayrit. Siguro, Doc, just to give them a little bit of an advice, ang hinihingi nila ngayon, masks, that's not available right now, what can they do?
Well, what they can do is avoid close contact with people, avoid crowds. That's really the best thing that they can do at this time.
Yun na lang, ano?
Yes.
Okay. Ayun, Alicia, yun ang advice sa'yo ni Dr. Dayrit sa mga oras na ito habang nga, well, hopefully though things go back to normal because you're saying that by March 9, back to school na. So that is Monday. I believe that's Monday next week, no, Alicia?
No, ma'am. Nag-adjust
19.
po sila ng another 2 weeks. So, March 23 po ang pasukan uli ngayon dito
see.
sa Korea. Opo, March 23 na. So kahit po ako, ma'am, wala po akong work for almost 2 weeks na. So, mahirap po talaga yung kalagayan namin.
Alright, Alicia, mag-ingat kayo dyan. Kasama ng ilang pa nating mga kababayan dyan sa Daegu City. Maraming salamat kay Alicia Lipato. Again, we'll be taking a short break. We're going to talk about the COVID-19. You know, I wanted to ask you, Dr. How do you differentiate if you have a common cold to the COVID-19? I want to ask you about the incubation period because it becomes a little confusing. Is it 14 days or has that actually increased? Those answers after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, former Health Secretary Manuel Dayrit. I just wanted to ask you this. So the WHO is saying it's on its highest level of alert, and I quote, it can go in any direction. What does that mean?
Well, it could mean that it could become worse or it could become better.
I see. Okay. That's what it can go in any direction.
Yes.
Let's look at stuff that we normally ask or talk about, no? An incubation period of this virus. Number one, they say it's 14 days, and then there are other reports saying that is actually extended. What is the incubation period of the COVID-19, Doc?
On the average, they say it's 14 days. So that's officially the incubation period.
Okay. Why does a person, once infected, gets well, gets infected again?
You know, that's what they don't know about, because this is a report from China, that somebody who got sick, tested negative, and then after a few weeks tested positive again. So there's something about this virus that we don't know about. Is it hiding somewhere in the body and then resurfaces again? This is something that research has to figure out.
Or is it possible that you were negative, but it's there, it's not showing any manifestations just yet, even in a clinical study, and then pag medyo mataas na yung level ng virus, tsaka lang siya magpapakita?
Yes, that's also another possibility. But these are all speculations.
But there's so many questions unanswered.
That's the reason they're saying we don't know very much about COVID-19.
Or how long it's not airborne, right? That's what they're saying.
Well, they're saying
it now?
it's droplet.
Correct.
But in certain situations, it could become aerosolized and become airborne and be transmitted farther than 1 meter or 2 meters away.
Right.
6 feet away.
Because they're also talking about how long does the virus stay on a surface. How long does it actually stay
Even
on a surface?
they say hours to a couple of days.
Days?
Yes, it's a range.
Some say it's even 7 days now.
Yes, and depending on the surface also.
Okay, here's the thing. There's community, how do you call that, infections. In the United States, that's still an unknown history of the man who died there. There are community infections now. Let's look at the situation in the Philippines. We only have 3 confirmed cases, although there are some still being tested in New Clark City, those that came from the cruise ship,
Yes.
sir. How prepared are we for any possible community spread?
First of all, I'd like to say that the government has done pretty well. We're still in the containment stage. Okay? So we have 3 documented cases. But we could speculate and say maybe some cases have come under the radar. We'll only know if some of these cases become serious and show up in a hospital and are tested. Otherwise, we wouldn't know.
We wouldn't know at
Because
all.
the symptoms of COVID-19 in comparison to influenza and other respiratory infections are very, very similar.
So, let me ask you that question again. If there is a community spread, are we prepared for something like that?
It depends on how catastrophic. If we're seeing cases 1, 2, 3, and, we could contain them. But if it's like in a mass rally and you get 50 to 100 cases all at the same time, we'll be actually very, very challenged.
Maybe such as the thing in Daegu City. You know how it was in that particular church
Yes,
that it
yes.
started and it infected a lot of other people. You're saying if something like that happened here, that would be a big challenge.
Yes, that would be a very big challenge.
As a last question, Dr. Dayrit, how will I be able to tell if it's just a common cold or a cough or I have COVID-19?
Well, you simply have to ask yourself, have I possibly been in contact with somebody who was infected? Somebody who came from China or somebody who had contact with somebody from China. Otherwise, just think that it's probably just a common flu.
But that's not a basis anymore, Doc, especially what happened to the United States, to that man in Washington State.
Yes.
No contact, no travel history from a country infected, and yet he died.
Yes. Well, if you really want to know, then go to Research Institute of Tropical Medicine or one of the DOH hospitals and get yourself tested.
Is the worst over?
No. I think we've only begun to see spread in other parts of the world. And therefore, as it's coming under the radar in many places, like in the US, like in Iran, it's going to spread further. We're only seeing the tip of the iceberg when we see the reported cases and the deaths. That's only the tip of the iceberg. Because the bigger iceberg underneath are all of those undetected and actually mild cases that are actually circulating in the community.
Maraming salamat kay former Health Secretary Dr. Manuel Dayrit. Thank you, sir. Good to see you again. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.